Assalamualaikum warahmatullahi wabarakatuh. Hi, I'm Dr. Linda, founder of Psychosocial Clinic Malaysia. I'm a certified advanced hormone therapy practitioner by International Hormone Society of Belgium and has been practicing for the past 10 years. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Masya Allah, kita bertemu sekali lagi pada bulan yang baru, minggu yang baru. Hari ini 1 hari bulan 8, 2021. Kita berada dalam bulan kemerdekaan, bulan Ogos. Masya Allah. Terima kasih kepada semua yang menonton. Terima kasih kepada anda yang bersama kita pada pagi ini. InsyaAllah kita akan bersedia. Tetamu jemputan khas juga sudah bersedia. Sebelum itu, Dr. Linda nak ingin bertanya apa khabar anda semua. Saya mendoakan kita semua berada dalam keadaan super sihat. Sekali lagi, Dr. Linda mendoakan kita semua berada dalam keadaan super sihat insya-Allah. Terima kasih pada anda yang menonton bersama-sama kami pada hari ini, hari Ahad. Insya-Allah kita sangat berterima kasih for those who be with us. Anda sedang menonton FB Live bersama Dr. Linda setiap minggu dan hari ini hari Ahad. Topik yang kita akan bawakan hari ini sesungguhnya ialah masih lagi berkenaan dengan apakah masalah psikologi ataupun trauma yang dialami oleh masyarakat kita khususnya iaitu kanak-kanak, remaja dan wanita. Sebenarnya topik best yang kita nak bawakan ialah acne, jerawat. Dia bukan saja stigma-stigma biasa, tetapi adakah juga adanya satu impact ataupun impact psikologi kepada mereka yang mengalaminya. Ya, itulah topik kita pada pagi ini dan tetamu yang saya bawakan juga sudah bersedia di dalam studio. Ya, saya dengan ini memperkenalkan, kita tak nak buang masa lagi. Sudah 2 minit berlalu. Dengan ini saya menjemput. Jom kita persilakan siapa yang berada di situ. Yes, very good morning. Before that, very good morning JC. Thank you for, they said good morning Dr. Linda. Okay, don't worry. Kita dah bawakan tetamu kita, dipersilakan Dr. Usha Ho. Dr. Usha, please welcome. Wow, Dr. Usha, how are you been doing?
Hi Linda. It's a pleasure meeting you on this platform. Yeah, this is pretty new for me. Hi guys, I'm Dr. Usha from clinic based in at the moment. Yeah.
Bagus Usha. Usha, I think kan kita ni dah berapa lama tak jumpa Usha? Can you tell me?
I think almost about 6-7 years kot.
Itu dia ya. Itu rahsia kami bersama. Alright. Sebenarnya Usha, sebelum saya memperkenalkan Usha, I can tell you siapa Dr. Usha sebenarnya kepada pengikut-pengikut saya dan follower-follower di FB dan follower Dr. Usha juga. Kami sebenarnya dah berkawan lebih 10 tahun. Can you say that?
Yeah, exactly. I think it's over 12 years, babe? 12 years.
Sebenarnya dah 12 years begini. Ceritanya kami berdua pernah bekerja dalam satu bumbung, satu klinik 12 tahun dulu dan kami ni memang mengganggu lah, orang kuat kerja lah, cakap betul ya. Memang kalau I bilik 1, Usha bilik 2. Macam itulah. Kalau Usha bilik 2, I bilik 1. Macam itulah. Ya. So, Alhamdulillah, I'm very happy, sangat gembira, pleasure to see Usha to meet up at this platform. Memang ni sahabat lama saya yang dah lama long lost friend ni. Tapi tahulah Usha ni dekat mana.
Not lost, long but not lost.
Not lost. The long je. Okay, anyhow, semua yang menonton, Dr. Usha sebenarnya memang seorang aesthetic physician yang dikenali ramai, berada di selatan tanah air, di Johor Bahru to be specific. Beliau ialah seorang juga medical aesthetic doctor dan juga medical director of MX Clinic. Sila follow beliau ya. Please follow beliau di Facebook. Dalam masa yang sama, siapa yang memerlukan jawapan dan sebagainya mengenai kesihatan kulit dan sebagainya, kita akan nantikan selepas ini. Baiklah, right? Dr. Usha ada banyak dia punya, I nak baca dia punya educational background. Tak apalah Usha ya, cukup dengan saya katakan Usha ni memang ya seorang doktor yang banyak kita panggil boleh kata aesthetic physician. She's one of the many yang dikenali ramai di Johor itu. Baiklah Usha, jom kita nak ready tak dengan topik hari ni? Kenapa kita pilih topik ini hari ni Dr. Usha? Maybe you can say something, some mukadimah, some opening to the followers. Silakan Usha.
Okay. Acne has been a personal journey for me. So memang when I was a bit younger, I memang banyak acne on my face. So I still remember last time tu macam kalau nak kata medical treatment or any kind of aesthetic treatment was very, very less. So my mom most of the time she'll just ask me to lie down on her lab, and then dia akan pecahkan all my acne just to remove the pustules, the nanah, and all those things. So
Wow.
I ended up with a lot of acne scar in my early years. And it was
Wow.
not acne scar on my face. I started developing a lot of keloids. So when I start having acne on my body, some of us can have acne on our body. That acne was starting to become like keloid. So I have a lot of acne keloids in my body. So when I started doing medicine, and then of course that point of time we didn't know what was happening to our face or our body. But now that I am in a
So,
state that I can help people to overcome this earlier, so that's why I spoke to you, Linda. Maybe we could talk about because when we look at acne, right, most of the time what people think is just very superficial, but a lot of people don't know that it has got a lot of emotional impact on that particular person. So the topic today is mostly is to talk about apa impact emosi kepada those person who's experiencing
yeah. Betul.
so
Thank you, Usha.
that will be one
Thank you
topic.
for the kind words. Yeah, thank you for the introduction. Sebelum tu Usha dah explain sikit, kita lebih nak melihat apakah impact psikologi kepada anda yang mengalaminya. Dr. Usha sendiri dah melalui saya sendiri. I remember those days I laser Usha, Usha I laser I. Macam tu lah.
We were fractionating. Correct.
Ya, kita orang buat kerja macam tu tau. I duk laser muka Dr. Usha ni, just tell me ya, bila ada kelapangan lah, when we have time in between kan, kita akan laser each other. Alright, itulah dia. Saya juga mengalami parut jerawat dulu masa muda-muda lah Usha. Nak buat macam mana? Kita muda-muda dulu kan. So at that
You
point
still
of
muda,
time,
okay?
muda lagi, seriously. Tapi muda yang real muda those days kan.
Yeah.
So talking about that, so hence we terpanggil, kita kata jom lah Usha, let's talk about this topic. Di zaman kita juga melalui another emotional issues, another impact of this current pandemic, insyaAllah kita akan tengok apa juga kesan psikologi terhadap jerawat dan parut jerawat ini. Boleh? Everyone ready? Alright, ramai yang cakap good morning Dr. Usha, good morning Joyce, JC, always. Yes, Josie cakap good morning Dr. Linda and Dr. Usha. Memang she's always every week memang follow kita punya FB live. Thank you JC. Alright, and also good morning. I think Hami is all the way from Sibu, Sarawak Usha. Kita ada yang menonton daripada Sibu juga. Thank you. Alright, thank you for having us. Thank you for staying with us. InsyaAllah, let's see what we can have. Usha has prepared us a lot of informative slides to share about. Okay Dr. Usha, jom. Maybe kita boleh mulakan Dr. Usha ya. Kita nak berbuang masa lagi. So basically kita nak tengok Dr. Usha apa sebenarnya jerawat ni yang kita katakan ada. Kita ingat jerawat ni benda yang biasa-biasa je, iaitu jumpa doktor dan dapat rawatan dan balik rumah. Okay? Mungkin Dr. Usha akan bermula dengan apakah sebenarnya impact jerawat ni sendiri dan parut jerawat. Silakan Dr. Usha, over to you.
Okay, first of all, I would like to apologize because this particular laptop that I have, dia punya camera tu dekat bawah and Linda's screen is on top. So you guys might feel a bit, sometimes I'm not really looking at you guys. I have to look up or look down to look at the slides. Okay, so please forgive me. Okay, so I think we can ask Rosie to put up the slide.
Slides, yes. It's good to start with. Yes.
Okay, like we said, we're going to talk about acne, which is bukan just plain social stigma. What I feel is it is giving a lot of psychological trauma to those sufferers of acne. So today kita go a little bit more brief, more than skin depth about this particular topic. So next slide. So yeah, that's like the younger me. Let's talk about impact of acne. So when we talk about impact of acne, right, this clinical study was actually done in the overseas. So we are looking at almost 50% of 50 million people in US are actually suffering from acne. And then when we were younger, we used to tell patients, okay, this is just like a problem of a teenager. When you grow a bit older, when you go into your 20s or when you go into 30s, acne ni dia akan berhenti or acne ni akan stop or it will just disappear. But this particular study shows that it doesn't stop. About 85% of individual teens have acne and 64% actually persist up to about age of 20s. And almost half, 50%, 43 to 50% of people have acne up to the age of 30. So in my experience, even those people who are 40s, even 50s are actually developing acne. So I do tell them, yeah, good, your hormone is still functioning, but when they have such a pure clear skin, masa diorang muda-muda ni skin is like macam flawless, but when they're hitting 40s, and of course now with us using a lot of masks, a
Betul?
lot of people are coming in with a mouth acne at the age of 40s, 50s, you know. So, but when we look at local study, there's one clinical paper that I saw for local study. It shows that about 67%, yeah, of adolescents, 13 to 18 years old of people, kids actually having a lot of acne issues, which is
Wow.
yeah, most of the time it's more than half adolescents of 13 to 18 years old having acne issues. So kalau nak kata impact of acne is very global, it's global. And what is the most important thing is early detection and aggressive. I like the word aggressive because the moment I see any kind of acne, because we know we live with the scars, right? So I am very aggressive in treating acne at a very beginning stage. So next slide, please, Rosie. So again, so as I said, acne ni dia bukan skin depth je. So a lot of people are actually having psychological issues. About 92% of people actually, this clinical study shows that 92% of people actually undergo depression, you know, because
Hmm.
yeah. So banyak orang tak tahu, and okay, can you guys enlarge the slide. Okay, this particular clinical paper was done by Dr. Ken in Alostar, Department of Dermatology in Alostar, Kedah. So diorang ni buat macam questionnaire. It was a questionnaire paper to check what is the perception and psychosocial judgment of people kepada orang yang ada acne. So example, contoh kalau you nak introduce orang ni, they compare two groups of people. Satu tu clear skin, another one is somebody who have acne. So then they did this clinical study to show that, say if you have a person who have acne, muka dia ada pimples, how would you introduce this person to your close friends? Or would you introduce this person to your family members? Contohnya, or example, now we are all very active in social media. Would you add on this person into your Facebook or Twitters, or or take some career advice, or take any kind of relationship advice from a person who have acne skin? So if you were to look at the graph, yang kuning tu is the clear skin and the bluish dark blue is the acne skin. So it clearly shows that perception of people kepada orang yang clear skin it generally becomes higher. Yeah. So this is actually you are judging a person. Probably they are very nice person inside, but just looking at the skin depth, we are actually clinically, I mean, sorry, we are actually judging the person, saying that yeah, you probably will not add this person to become your friend. You probably will not introduce this person to your good friends or family members, and stuff like that. Another slide, please. So this is very interesting that I saw. Okay, enlarge the slide. Sorry, I have to look up and then look down. Sorry. So this is another interesting one that they did. That willingness to hire a person to secure a job, and also for them to vote a person for certain position, or I don't know, some committee stuffs like that. So bila diorang buat clinical study ni, they noticed that even for job application or for you to hire somebody, they don't actually look at your skin. If it's a clearer skin, they probably have a higher chance of securing the job as compared to those people yang ada jerawat.
Betul?
So yeah, so this is one interesting paper that I came across, and very interesting that it is done in a local. It was like a questionnaire kind of a study they did, yeah, observational study. So next one. So like Linda was saying, psychosocial burden. So kalau kita nak kata psychosocial burden, memang psychologically, a lot of my patients when I see them, right? I do take a clinical history, normal clinical history, dah berapa lama pimples ni, how do you treat me, and stuff like that. But I always make it a point to take the psychosocial history from them, which if any of you guys are medical person out there who's doing treating acne and all, make it a point. I say this in all my talks to fellow friends. Make it a point to take the psychosocial history for those patients who are suffering from acne. Because sometimes, right, kita tengok patient ni, ada sebiji dua je pimples dia, macam the skin is so flawless, and then they just have one or two and they will be so hyped up about it. Diorang macam
Betul?
panicking.
Mm-mm. Mm-mm.
Selama ni I tak pernah ada benda ni jadi parut ke apa. when you want to see this kind of person, you need to understand what is happening inside. All the while, the skin has been flawless, and suddenly one, two pimples. Macam kita ni clinician, kan, we have seen the worst of acne, kan? So when you
Sure.
see you'll be like, kenapa macam hyper sangat patient ni, kenapa? But actually, psychologically, the person is undergoing anxiety, a lot of stress because they develop that kind of thing. Sebab sebelum ni tak pernah. And when you look at the another extreme, muka dia penuh dengan acne, a lot of pus and pecah,
Jerawat.
and they will be like super cool with it, like, macam tak ada perasaan, So
Reda je.
dia buat dia je. So psychosocial history is very important for us to know what is actually happening inside. A lot of patients are depressed. Macam diorang ni kemurungan, they just give up. Alah, fed up. Doktor kata kalau teenager dah masuk 20 dia akan hilang. Ni dah masuk 30 pun tak hilang-hilang. I keep having acne. So at one point of a time, diorang jadi fed up. So depression and then self-conscious. They put a lot of makeup to cover up. Thick makeups to actually worsen the existing acne because they clog up, betul? And then they after some time, right, when they start accepting it, they become angry over it. Why me? Why I as a now? Why mine is not recovering? Why my friend who had the similar problem recovered and got better? Why mine is? So it turns into anger, and then they become violent and depression, anxiety. So all this history we have to capture when we see anybody with acne. Then when we talk about social history taking, so their dating histories, like I said, even to introduce you this particular person to family members, there is like nampak tadi dekat graph tu kan, it's very different. And then when we talk about employment, even nak cari kerja pun, if you have a lot of acne, a lot of scars, you might not be the option, if you know what I mean. And then school attendance, college attendance. So all this kind of history taking in patient, I always make it a point. I take all these particular histories when I see patients with acne, because like I said, the clinical presentation, contoh patient yang teruk acne dia, patient yang macam sebiji dua je. So this actually does not indicate diorang punya quality of life. Okay, so quality of life is like those person with a lot of acne might have a very good quality of life, very relaxed, very calm, ala pimples je apa pun, but those yang clear skin dapat 1-2, they will be anxious, they are not attending college, or they're having issues with their relationship, and then so this doesn't show their quality of life. So taking history into that part of it is very important for me when I'm treating acne patients. Yeah, so
Betul. Yeah, Dr. Usha, I agree with you. Before we go to the next slides, is actually I always train my team as well. Bila kita melihat ada seorang datang dengan patient lah, kata nak jumpa doktor kenapa? Ni nak check nak cerita pasal jerawat. Maybe they say that way kan? Saya ada jerawat ni. Don't judge them straight away. No, mana kita tahu, walaupun kita nampak satu, maybe you can say tadi, tak nampak pun jerawat dia. Macam tu, exactly. I always advise or train our team not to do that from the first place. It means kita tak ada rasa empathy pun dekat patient if we put that way straight. Kita letakkan that judgment from the first place, in the first place. So sebab tu kalau patient datang dia kata nak jumpa doktor sebab how do we know jerawat satu tu dia bergaduh dengan we don't know,
they have a lot of social history. I mean, for them to actually bring themselves to see a physician in the first place, that would have taken a lot of effort, kan? For them to
kita from our point of view jangan nampak remeh lah benda ni, when you say lah, alah dia bawa mak bawa anak, jerawat dia 2-3 je kat muka, let's say, we have that. Don't judge for that. Kita tak letak empathy pun dekat patient tu. Kita tak rasa patient tu rasa kena rasa dia apa yang dia rasa sebenarnya. So with that, I think that's the first important that we should do as frontliner. Kita ni doctors, betul, dan team and semua, doktor, nurses, please have that little empathy, lebih empathy sebenarnya kalau kita melihat, kalau tengok dah jerawat, dah ada kita panggil parut tu, memang kita rasa macam this patient need help. Betul tak, Usha?
Yeah.
So I
Yeah.
agree with you from the first place. Don't make judgment to these people, patient yang minta for help, yang cry for help. Hence we are here to help those yang memang memerlukan. And with that, kita tak nak jerawat tu, Syah, sakit tu di sini tau. Seriously, when I say jerawat ni parut jerawat. When we see a parut jerawat, it's so much so hurting. Betul. Sakit tu kat sini ni. Seriously, boleh tengok because ada sebab Dr. Usha nak share kenapa parut jerawat ni ataupun jerawat ni kalau kita tak bantu daripada awal, dia akan develop parut dan sebagainya dan dia akan permanently sakit dan whatever, dan of course ada rawatan, tapi Dr. Usha ada butirannya. Over to you Usha about this early and aggressive treatment to prevent scarring. Please, Usha.
Okay. So, like I said, I'm very aggressive in managing acne. So, aggressive treatment for me, the very important word here is prevention. Kalau
prevention,
prevent the scar from happening. So, whenever I think anybody with even a bit of acne, I jump in and treat it very fast to prevent the scar. I tak nak muka dia ada scar. That's the most important, my objective lah. Yeah, my objective. You shouldn't have any scar on your face. So when we look at acne, right, most of the time, acne is actually a disease. Just like macam mana kita treat asthma, we are treating diabetes, hypertension. Acne needs to be treated. Sebab benda ni is an ongoing chronic inflammatory process. Yeah. Dia bukan benda yang you see doktor pakai ubat dia hilang. It doesn't.
Habis.
So, patient have to understand that for you to actually see noticeable result yang boleh nampak dengan mata kasar kita, it takes about 3 to 6 months. So doctor shopping is another issue that I encounter with patients. So they always tell me, so another thing, when I take history, I always take history. Where have you been before? What have you done?
Okay. Yeah.
So you can see that they jump from so many doctors. So I make it a point to my acne patients before I treat them, I will always ask them to give me 3 to 6 months. If you cannot give me 3 to 6 months, then you might as well not start the treatment with me, because I'm not doing magic here, for me to immediately give you flawless skin within 2 times.
Betul.
So I always tell them, you will see noticeable result 3 months up to 6 months. Like for myself, I took medical treatment for almost 2 years, and for me to improve my keloids. So even now I still develop keloids on my chest, on my backs, and all those things. So for patient, it's very important for them to know jangan buat doctor shopping for acne, because all doctors out there, Malaysian doctors, all of us have been trained well in managing acne. Kita orang dah ada CPG, dah ada guideline, everything is in there. So there is no one doctor who knows better than the other doctor when it comes to acne. Acne ni benda standard. Macam all the doctors can manage diabetes, asthma, hypertension, all the doctors can manage acne. It's just that certain doctors might have a little more things, like macam kita orang ni buat aesthetic, so maybe kita orang ada lasers and those injectables. So you're just one step aja, but the basic things when we talk about topical treatment, ubat sapu, ubat makan, macam chemical peel, most of the time most doctors have all the treatments available. So very important, just choose a doctor. That's another thing. Choose a doctor to treat your acne, because only doctors will know what is happening inside. So patient yang dengan severe inflammatory acne ni, they can develop scar up to 7 times. A clinical study shows that the moment you have acne on your face, there is 7 times you developing scar, because it's an ongoing inflammatory process. And then those patients who don't have early treatment, contoh you dah biar benda tu for about 2-3 years, you have at least up to 3 times chances of developing scars. So first thing, early treatment. Second thing, yang severe tu cepat-cepat lah, so that you don't develop scars. So can you guys enlarge the slide?
Alright, the slides. Yeah, can do that. Okay, good.
Okay. So acne severity is an important factor in selecting treatment. This one, that's why another thing, patient always ask me, doktor, kawan I buat treatment macam ni, macam ni, macam ni. Kenapa untuk I you buat treatment macam ni, macam ni, macam ni? So when we look at you and when we look at another person, your skin and another person's skin is never the same. So when we do acne management, dia tak pernah sama. Sebab if you look at acne protocol, CPG tu, dia banyak modalities of treatment that we can start for you. So don't compare your treatment with another friend. Oh, kawan I pakai ni and then dia dah improve doktor, dia dah baik dah doktor. Kenapa untuk I you tak boleh bagi tu? Kenapa untuk I you tak boleh buat tu? So I do get patients who question me this. So I always tell them, skin is different. Your stage, your grading of acne is different. So how I deal with that is, bila I tengok you at that grade, that is the treatment protocol yang I akan start for you. So I think I'll explain the next slide, please. So I'll go back to the treatment part after this. So when we talk about acne risk factor trigger, macam sekarang I cakap, mask is giving a lot of perioral acne. They are coming up with a lot of acne around tempat yang diorang pakai mask. That's one thing. And then second thing is duduk kat rumah, right? We are cooking and eating like 6 to 7 times a day, correct? So food induced. So when we talk about diet, right? A lot of patients ask me, doktor, kalau makan pedas, dia naik pimples ke? Kalau makan kacang, naik pimples ke? Kalau makan seafood, naik pimples ke? So, clinical study shows that only 2 types of things, dairy, susu, anything that comes with milk, or high glycemic index, benda yang terlalu manis. So, susu can be in the form of cheese, you banyak makan pizza duduk kat rumah, or pasta, you know, a lot of. So, this can induce hormonal changes in you and play with your pimples. And another thing is high glycemic index food, benda yang terlalu manis. So some patient tell me, doktor, I makan chocolate je naik. So chocolate, it's not the cocoa. It's got the 2 things, sugar and it's got the milk. So if you're eating dark chocolate, maybe you will not get pimples, you know, that kind of stuff. So food, kalau nak kata makanan, so far there is no clinical studies that shows that certain things can trigger acne except for milk and sugar. But if you notice ada this particular patient, doktor makan kacang, even myself makan kacang je confirm naik. So if you think that is causing it, then you don't do it, you stop it lah. That's what
I agree.
I don't
before you go on, sorry, we have one viewers, Priscilla. Say good day, Dr. Linda, Dr. Usha. Say hi to her. Hi, Priscilla.
Nice having you here. I was thinking about you this morning, you know, when I want to talk a bit about cosmetic products. So
yes, see?
Our it when it comes to mineral makeups.
Good vibes. All right, okay. All right, go on, Usha. I just want to say.
Yeah, so diet, when we talk about diet, that's one thing. And then stress, memang all of us tengah stress sekarang kan with all this COVID stuffs happening. So that is generally memang because it plays with our hormonal control. So certain medications, so some patients who are on contraceptive pills, some patients who take certain kind of medication, even medication can actually trigger acne. Yeah, some kind of supplements. Yeah, I have some patients yang ambil diorang pergi gym and then they do protein shake, protein intake. So too much of that also have triggered acne. I have a lot of male patients who come in with me with acne triggered by gym products. Yeah, so because I don't know if they have some kind of hormonal content in that product yang menyebabkan diorang erupt acne. And then when it comes to certain job, I had one engineer who worked with Petronas. He came with sudden triggering acne all over his face, neck and everything. So on further questioning, this guy works with, dia buat quality check on petroleum. So he works with a lot of oil. So that has triggered acne in this particular engineer. So another thing is suka tangan letak macam ni, suka rub the face, even skin.
Too much touching. Too much touching kan?
Of your face can actually trigger a lot of acne production. So kalau nak kata risk factor ni memang banyak. So the basic ones are this hereditary. There is some clear correlation, strong correlation to say that genetic lah. Kalau your father, mother, parents have acne, there are chances of you developing. But I have seen kids who parents face clear tapi they still develop. Then we have to look at other reasons. Why is it suddenly happening? Yeah, so these are some of the acne trigger factors and risk factors why suddenly you boleh develop acne. And remember, acne can start at any point of time. Okay, at any point of an age. So when we talk about pathogenesis, benda yang boring sikit, but I believe all of you who are listening today, you need to know how pimple ni berlaku. Okay, when we talk about, we have to talk about the sebaceous gland, kelenjar minyak, which is inside our skin. Yeah, kelenjar minyak is attached to the hair follicle. So what happens to this kelenjar minyak is that when our internal skin is a little bit on the drier side, yeah. So kelenjar minyak ni dia punya function is to produce oil to hydrate our skin. So minyak ni akan keluar and then menyelaput kita punya permukaan kulit to give us some layer of protection daripada air hilang daripada permukaan kulit. So what happens in acne patient is that this sebaceous gland gets triggered by hormonal influence because of hormonal imbalance, increased androgens or imbalance of estrogen, progesterone. So kelenjar ni gets activated and then dia keluarkan banyak sebum minyak, and when dia banyak sangat benda ni jadi clog up. So when it clogs up, that's when you start developing macam we call it comedones, baby pimples. Yeah, in Malay you call it what? In the comedones ni cakap apa? It's not
dia kita panggil white macam whitehead.
Blackhead. I'm not sure in Malay. So blackhead and white, bila kelenjar ni dia dah clog up. Then second thing is those patients yang ada acne ni, generally your skin surface ada banyak P. acnes. This is a kind of bacteria. That can trigger acne in certain people. So when benda tu dah clog up and then it gets inflamed and then bacteria ni overact pula on that sebaceous gland, it gets infected. So when it gets infected, nanah will start collecting under your skin, and at final time dia dah tak boleh tahan, it will burst. So when it bursts, superficial skin scars up. So this is general pathogenesis of acne. So if you can increase the slide.
You want to zoom in, right? You want to zoom sikit. Okay.
Acne, right? I normally classify my acne patient whether they are the non-inflammatory type or they are the inflammatory type. So the non-inflammatory type tu macam yang very very mild. Normally I get a lot of teenagers coming in with this. They have comedones, they have blackheads and whiteheads, open comedones and closed comedones. These are non-inflammatory, not so dangerous, takkan scar up so much. If I just put them on topical ubat sapu, it will just settle. Then we have the inflammatory type. This is a little bit more severe type. They start developing papules macam berbiji lah, and then they start having pus, nanah. And then the severe type is when they start developing nodules. So when you touch the patient's skin, dia macam ada buah anggur dekat dalam tu. It's like a cluster of grapes dekat dalam. Dia macam berketul kat dalam. So that is already nodules. So nodules ni memang chance of them to develop scar is up to 70 to 80% if I don't jump in and treat immediately. So grading of acne ni very important. This one is for us clinicians lah, Linda. So patients, those of you who are viewing, I just want to explain to you guys how doctors actually decide mana ubat yang sesuai untuk you. Apa I nak buat untuk patient ni? So when we look at grading goes from 1, 2, 3. So the 1 is the mildest, they only have comedones. Okay, second is they already have pustules. So these kind of patients, usually I can add on ubat makan. You probably have to start taking some kind of oral medication. Then the third one is when I really jump in and aggressively treat to prevent scar formation. Sebab that grade 3, severe grade, those with nodules, they are very prone for scar, and by that time they are already in the stage that if I don't treat, memang confirm scar. Yeah. So next.
Yeah, this is very good to show. Dr. Usha menunjukkan ada banyak grading kan. So kita tak nak yang severe tu. Kita tak nak yang worse, ada nanah dan meninggalkan parut yang lebih dalam, right? So ada banyak jenis parut nanti kalau dia nak sembuh, ada banyak jenis parut. So inilah dia beberapa yang Dr. Usha nak tunjuk lagi kan. Ada beberapa slides lagi Dr. Usha nak tunjuk, share apakah sebenarnya yang Dr. Usha ada, sebab acne ni kan Dr. Usha bukan just dekat muka je, betul? So ramai yang risau, yang ada bertanya juga dengan kita, Dr. Har buat bahagian-bahagian lain. Nanti kita please ask questions. I nampak ada questions yang coming in. Kita akan entertain the questions in about a bit more time, in about 5 minutes time. Yeah. So for now, Dr. Usha nak kongsikan sedikit lagi apakah yang her real experience in fact ya. Ini ada beberapa gambar yang Dr. Usha nak tunjukkan sebelum tunjuk Dr. Usha punya patients. Over to you, Usha.
Okay, so another most important thing that I want to explain in the previous slide, right? Not necessarily those yang in grade 1 tu akan jadi grade 3.
Yeah.
That you have to understand. Bukan semua patient yang you first dia mild and then lepas tu dia akan jadi moderate and then dia akan jadi severe. It doesn't happen that way. Yeah. So if you're the mild type, most probably you are just the mild type and then dia akan recover. But if you are the severe type, dia start pun immediately dia akan start dengan nodules and cysts yang banyak. So that I need you guys to remember. It doesn't go that way. Yeah. It just starts like that and then it kickstarts. Yeah. So next slide, please. So when we talk about scars, this is what me and Linda we are trying to prevent in our patients. Yeah, day-to-day basis we fight for this. We don't want you guys to end up with scars. Next slide, please.
Parut jerawat.
So when we talk about scars, right? Okay, scars ni dia ada banyak jenis. So yang tadi tu macam you guys saw all the depressed scars, right? So the standard scars that we see is sometimes is just pigmentation. It can be PIE. PIE ni post-inflammatory erythema. Bila pimples tu dah hilang, the thing just becomes red and it goes on for months and months and months. Benda tu merah. Okay, so this is called PIE, post-inflammatory erythema. Then we have PIH, post-inflammatory hyperpigmentation. So this we see in patients yang a little bit on the darker side. So bila dia dapat pimples tu recover and then dia akan jadi black spots. And the unfortunate ones, they get hypopigmentation. It becomes like whitish spots. So this whitish spots, yeah, it's a little bit more difficult, more challenging for me to treat. Yang post-inflammatory hyperpigmentation, bila dia hitam tu, it's very easy. We can give topical medication, we can do peels, or we can do lasers to improve the color of the skin. But one important thing that I wanna say here is this PIE, PIH, yeah, for you guys yang start having acne, for you to prevent you from developing PIE or PIH, start using good quality sunscreen. Yeah, sunscreen. So whenever you have any kind of inflammation on your face, protection against UV is very important for you guys to prevent the development of pigmentation. Okay. Then we have scars. These are the scars yang I dread the most. When the scars become hypertrophic or some patient it becomes keloidal. Yeah. Keloid and scars are a little bit more difficult, and this usually happens in those patients in grade 3, yang severe with nodules too, they might develop this kind of scar. And I do see this more in men, generally more in men. Yeah. So next slide, please. So when it comes to acne in my clinical practice, just to share a few slides. Next one.
Okay, so this is nice. Before that, Usha, so this is what Dr. Usha is trying to explain and share actually what the journey of healing this acne scar, right? And dia bukan satu hari, dia bukan overnight. As I can remember, Dr. Usha dah sebut tadi, 2 tahun makan ubat, laser lagi, injection lagi dan sebagainya, right? Let's hear from her because I remember memanglah kulit kita memang berkawal-kawal lah, Usha, Yep. Alright. So what she has done, please share, Dr. Usha.
So like you can see, it's me injecting myself with some process to stimulate collagen. Yeah, I'm not very young anymore. So scar, bila kita cakap kat scar tu, some patient even have scars here. Like I have scars
dekat tepi ni, temporal.
And I have scars on the cheek, So let's go to the next slide. So
this is important.
This is the slide which I'm going to talk more. So how do we prevent scarring? So this is the reason why I really appreciate this session with Linda. When she called me, I was like, oh, right, yeah, we're doing about acne. So this is why we have this session today. What are we trying to do to prevent the scarring? Okay, anybody and everybody is having acne now, but how can I prevent the scar? So that is what we are doing today to create awareness by doing campaigns. We are doing webinars, talks. I even do some school talks. Yeah, I go to schools to give them talks to students to educate them, to create awareness that acne is a disease and it can be cured. Yeah, so to develop the intention of certain individual to actually go and seek help. So banyak orang yang ada, banyak like me, especially men. Yeah, so most of the time men are a little bit reluctant to seek treatment, but the
Wow.
the worst case scenarios are always happening to men. But of course we know that's the androgen, right, part playing the role in giving them a lot of nodulocystic acne and scars. So men ni, diorang ni susah sikit to get that intention to come to see doctors. So please, if you guys are listening out there, men usually scar the most. Yeah, and then the knowledge, what we're trying to do today is depart knowledge, share knowledge yang kita orang ada sikit ni to those of you out there, so that you can go on and share to other people that acne can be treated and done early can prevent scarring. Okay, then of course to make you approach any doctors. Yeah, there is no one single doctor yang terror bab acne ni. All of us are super good when it comes to acne. Betul tak? You know, so I mean it's like a bread and butter for
That's the word. Bread and butter. Maksudnya kita tengok hari-hari dan kita boleh bagi management.
It is not just aesthetic doctors, any doctors, your family physicians, your general practitioners, anybody that you can see, even when you're going to clinic kesihatan for some other medical issues, you can see your doctors there. The doctors can treat your acne with very, very basic medication. So the approach, go and see physicians, is very important. Okay, then let the clinicians evaluate you, tengok apa problem you, speak to you, thorough evaluation is taken. If you're going through some psychosocial issues, if you're depressed, kemurungan, anxiety and all those things, they will channel you to certain other doctors who have the expertise to manage that part of you. Yeah, you probably don't see the relationship of acne and kenapa my life is like macam problem je, you know, you don't see the relation. But when you see some clinician, they might be able to see the relation and help you to untangle the issues that you guys are going through. So okay, and of course treatment, for us to commence the treatment as soon as possible. Yeah, so next slide. So again, kelenjar minyak is not the only problem when it comes to acne. Yeah, so there are 4 main pathophysiology that we always target when we're treating acne patients. So kelenjar minyak tu satu. Second thing, kita punya skin ni, the turnover is a little bit increased as compared to another person. Yeah, so keratinization we call it. Skin kita ni macam jadi tebal lagi cepat. I memang kulit tebal, so the so the thickening of the skin, the keratinization is another pathology. Sebum production is another one. Inflammation, kita ni senang inflame, merah. Okay, keradangan kulit tu cepat in these patients yang ada acne. And the last one is the bacterial infection. So for pathophysiology ni, doctors akan target all the 4 pathophysiologies so you get the result faster. Okay, next slide.
Wow.
Management. When it comes to acne management, it is pretty simple, very straightforward. So topical, ubat sapu, ubat makan ada. And then when we go to a little bit more advanced, we go for minimally invasive procedures. And of course, in my practice, I do a lot of scar treatment and prevention. Yeah. So next slide, please. I think we are running late.
Yeah.
So some concepts in management of acne that I do. So kalau nak kata medication, you guys can see there is like you can have a shelf of medications for acne. So depending on what stage, what grade you are, the doctors will decide which medication to choose, whether it's ubat sapu ke, makan ke. So normally I always tell my patients, I do combination modality. So first when you come, if it's very mild, I bagi you ubat sapu. I'll see you back in 2 weeks. If it's not responding or it's getting worse, then I probably will add on ubat makan. pula. And then I will start assessing other things. Are you having some hormonal issues? Are you having some kind of other medical issues which is giving you the acne eruptions? Then I will do that. Then when we talk about medication, like I said, banyak. Okay, zinc. There's one thing I want to mention about zinc here. Zinc is very good for you guys to add into your regime as a supplement if you have acne. Yeah? It really helps to improve the inflammation and heal up a little bit more faster. So kalau nak kata ubat sapu tu memang banyak. The standard one that I will always start on my patient is retinoids, topical retinoids, and then benzoyl peroxide gives very good amazing results for maintenance purpose sebab dia tak resistant. And then we have topical antibiotics. So antibiotic ni very important. When I tell patients, when I prescribe to patient, okay, guna ni untuk 3 months, come back and see me, and then they go disappearing and they will be using that antibiotic for years, and then they develop resistance, and then they develop a gram negative in a manifestation of acne pula. So some patients, sometimes when the doctor start you on something and tell you to come back, bukannya we want to start some other treatment or whatnot. The reason for us to ask you to come back is for us to monitor whether you are actually responding to the given treatment. Benda tu, is it working or not for you, or do I have to change to something better? So always remember that sometimes young antibiotic, especially overuse of antibiotic, yeah, they just buy over the counter and then they use it for very, very long term. So medications, when your doctors start you on medications, follow through, follow the appointments, and then speak to your doctors. It's very important for you guys to speak to your doctors. What is your concern? So I always spend a lot of time speaking to them about their concern. It's cost your concern. You tak boleh datang jumpa I ke? This kind of thing is very important when we are doing acne management. Speak up, yeah, speak up. Jangan malu, jangan takut nak tanya dengan doktor, how long will the treatment take? Or what can I see? What benefit will I get? Ask, because you're paying for all the treatments. Then we talk about other modalities. Microdermabrasion is one exfoliating device that I use for those patients who have a lot of comedones. Then we have peels. We have chemical peels like glycolic and salicylic acid peels. Even there are some home-based peels yang you guys boleh buat kat rumah. So this peels and exfoliation is actually just to remove the top layer of our skin, and it also to some extent improve our scalp and fine lines. Yeah. So then we have light therapies. PDT is very good for acne. Yeah, red lights, blue lights. We have PDTs. We have visible lights. Then we have laser therapies. I use a lot of laser therapy for my scar management, not for acne per se. It's for the PIH, the post-inflammatory hyperpigmentation, and for those patients who have depressed atrophic scars, I do a lot of laser therapies. Yeah, pico lasers. Yeah. Then when it comes to scar management, I always do multi-modality approach. So like Linda said just now, we do a lot of fractional, we do a lot of resurfacing lasers, and then kita akan buat bursts yang stimulate your collagen to fill up the scars. I even use fillers to fill up the scars and stuff like that. I do a lot of skin tightening, because when you have scars, when you tighten the skin, the scar actually look a little bit better. So different doctors have different techniques to do certain things. Yeah. So next slide, please. I think I'm almost done.
Yeah, almost apa tu, Usha. I think that was a wonderful sharing daripada tadi tu. Yang the last slide tu bukan last lah, the baru Dr. Usha explain tu was very nice, right? This one, right? Kita buat semua benda ni. We can say that, yeah. But for information, Dr. Usha, Dr. Linda dah sangkut dah I punya laser, I can say that. Macam mana kita sangkut, what I'm trying to say, I dah lama tak buat, I used to do, Dr. Usha tahu, kita banyak buat rawatan-rawatan begini. Nowadays, I lebih fokus kepada rawatan-rawatan, women's hormone dan sebagainya, as you all know. And of course, Dr. Usha is one of the many doctors yang you all can go and look for. Right? You can refer to Dr. Usha yang memang buat banyak merawat pasien-pasien yang ada acne, nak beri rawatan lebih further yang menggunakan rawatan-rawatan lebih minimally invasive, like kita panggil laser dan rawatan-rawatan injections dan sebagainya. Okay, so kita nak cerita lah, dulu-dulu memang zaman-zaman dulu memang I selalulah buat benda ni, and now as I said, Dr. Usha yang banyak buat daripada saya, right? She sees more than the acne patients than I do now.
Well,
Alright.
of course, you are doing the most important thing, Linda. You're preventing all these things from happening in the first place.
Very yeah, that's why I can hear that. So sebab that's why we are a team. Kita ni a co-manage patients like a team, right? We don't do everything that kita rasa kita ni super power. Betul tak Usha? Betul Usha. I think this is very important. Whatever we do, my part, my team, we treat internally, right? Betul Usha duk mention banyak kali about hormonal. That's our sincere, yang I buat sekarang. I have to say that, I have to declare that I have no more doing lasers in my practice anymore with the current situations. Personally doktor lain mungkin ada buat, tapi for myself I dah resign dah Usha. Yeah, but I do focusing the women's internal hormones dan sebagainya, right? So that's why we want you all, please look for Dr. Usha if you need help, of course. Alright, Dr. Usha, what do we have? Few more slides yang kita ada. Sebelum kita raikan questions, we do have questions from Ashley. Hold on Ashley, hold it there. We are coming entertaining your questions. Yeah, soon, very soon. Alright Usha, over to you.
Okay, so beautiful skin requires commitment. This I always tell my patients, you need to be committed with me at least for 3 to 6 months. You gotta see my face at least for 3 to 6 months. If you want some kind of result, this is not miracle. I'm not doing magic in my clinic. Yeah. So this is very important for patient. You need to be committed. Basic skincare. Cuci, moisturizer, sunblock. Standard. Kena ada. If you're not doing that, I'm not treating you. So that's one thing I always tell my patient. Facial wash, moisturizer, sun protection. I do not prescribe. You can use your own. You can use whichever that you're using. This is standard skincare. Then I will start treating your acne. Yeah. So next slide, please. Almost ending, I hope.
Yeah.
So some of my patient profile. So please don't take photographs and stuff like that. So this gentleman actually came into me very depressed. He had very bad scar on both sides. He looked much older than his age. So in this patient, this is after a fractional laser I have done filling. I filled up with some radiase and I've done some redurance on him. So for him, there was no active acne. Dia punya scar je yang tinggal. So this is scar management. If you see his jawline, jawline tu macam bila I tengok empty and jatuh. So I had to fill up that area to give him a little bit more obvious result. Yeah. So next slide. So this is actually my staff. If you guys can enlarge the slide, boleh enlarge the slide?
We can do that. Yeah, we can zoom in. Yeah.
So she had a lot of acne with post-inflammatory hyperpigmentation. Yeah. So she was planning to get married. So for her, we started her on topical medication. We started her on some mild lasers to improve, and then this was the result she achieved. Next, this is after 3 months. So you can see generally the skin really improved. Next slide, please. Yeah. So a lot of
same one, yeah.
So next patient.
So this impressive results.
So this lady actually dia start guna one kind. She is 43-year-old, yeah. So she started using a kind of facial mask, and then bila dia pakai face mask ni for about 1 week, after which she started developing a lot of like comedomal acne over her chin, and dia punya dia punya serum daripada mask tu meleleh dekat bawah. So she had also she developed. So cosmetic, a lot of patients sometimes diorang tak tahu certain type of cosmetics, certain types of makeup that you guys use, mask, can actually give rise to this kind of issue. So in this patient, I had to start her on topical medication. I did do pico laser on her. So this result was actually after 3 sessions of pico laser and medications, which took her again 3 months. Yeah. Next one. I think that's the end of my slide. So being challenged in every day we are being challenged in life, yeah. So but I choose not to be defeated every single time. So I try to to help my patient in any way that I can, based on whatever that they ask me for. But of course, not the treatment part. I tend to adjust according to what they want and at what point of a time they want. So being defeated is really optional. So you guys need to start seeking help if you need it. There are many doctors available. And so, yeah, thank you very much.
Wow, Usha, I think that's a wonderful presentations on top of the sharing of your patients as well who have been successfully managed by Dr. Usha. Alhamdulillah, and you can see such wonderful results as well. If we follow consistent istiqamah, and that's the word, right? And stick to the regime. That's so much important because it's not an overnight thing. Kita don't do magics. Right. So
Yeah.
Tosha, I think it's time. We have 5 minutes to end actually, but we please have one questions. Actually, I had a few questions. Can we get the questions admin from Ashling? Can I pop up these questions, Dr. Usha? Ashling is our followers too. Every week should be having with us, of course. So she was asking, of course, acne grows on different areas of the face, indicates different problems to our body. Is that true? Okay, what I'm trying to say, maybe dia kata cheeks tu maksudnya lain, indicates lain. Kalau dekat acne, dekat jaw tu apa maksudnya as such? What is your take, Dr. Usha?
Okay, okay. When we talk about acne, right? Acne ni macam doktor explain tadi, dia daripada kelenjar minyak, sebaceous gland. So when we talk about sebaceous gland ni is only on certain area of our body face. We have it at the front of our chest and we have it at the back. So kalau nak kata
Betul?
acne, it will only come on these areas. Kalau tempat lain tu, itu bukan acne. That's first thing first. And then second thing, like I said, certain triggering area, like macam sekarang kita banyak tengok patient acne kat sini. Mask, you're wearing mask. Or you're using
Pakai
macam
mask.
patient pakai one kind of product mask untuk hydration, air dia meleleh and then you get acne there. So different kind of things can happen at differently. So but that thing that you're telling me acne grows on different area, it's not myth, it's not true. So it depends on what actually is happening at that point of a time. So acne ni only face, front,
Yes.
chest and back. Tempat lain tu maybe it's not acne. So I hope that explains to Ash. I hope that explains Ash.
Yes. Actually, yes. I think it answers the questions, of course, because betul. So kita kena tahu what's really happened at that point of time. Yeah, and if you need help, please talk to your doctors to find out what is it if you're having or suffering from. Kan?
Correct.
Alright. Ada any more questions, team? Ada seorang Sharifah Kasim say hellos to you, doctors, of course, to Usha at the same time. Okay. I think we're close to. Sharifah Kasim, of course. Yeah, I think we have to summarize, Usha, in view of time. Yeah, so kita tak nak ambil masa so much on your Sunday. We appreciate so much masa yang Dr. Usha berikan kepada kita. 1 hour solid talking about this acne and the physiological. Alamak. Alamak. Ashling say something, Usha. So cute. Thanks, Dr. Alamak. Macam tu. Dia beautician tipu lah. Aduh, jangan cakap macam tu. Never mind. Dr. Usha has the answers. So, don't worry. Okay,
Maybe
Ashley. So
not
cute
tipu,
all that.
maybe not tipu, but they are just explaining based on what they understand, you see. So
Yes, I think that's great answers, right? They understand that way and they were trying to explain to you that way. I think maafkanlah, you accept for that point of time. Thank you so much, Ashley. Alright, so Dr. Usha, kita bagi summary sikit before we end sebab kita nak ada share juga to the followers kita next week, the same time, same hari yang sama, masa yang sama. Kita minggu Ogos ni ialah minggu a lot of psychological impact, psychological issues. Kita nak cerita banyak pasal psychological. Kita bermula dengan face acne dulu. With the current situations, kita ada banyak sangat masa pakai mask dan sebagainya. Kita dah discuss. Please shout for help. Of course, Dr. Usha ada summary sikit untuk beliau kita kata to end this session. Dr. Usha akan beri sedikit summary. Please, Dr. Usha, over to you. What is your harapan? Apa yang you rasa? Apa yang you mengharapkan? Silakan.
Okay, the first thing first, Linda, you're doing a great job. Yeah,
Thank you.
preventing all this from happening in the beginning itself. Yeah, managing the hormonal part of it, the most important cornerstone, the hormonal part of it. So you're doing a great job. So kalau nak kata summary ni, I think I blabbered a lot from the beginning until then. So the most
Yeah.
important thing, I don't want to see anybody coming with me with or to me for scar. That is the most important thing that I nak cakap. So
Goal.
so people who have I don't know, parents out there, young adults, yeah. So kalau yang nampak acne tu, start treating it. Jangan self-medicate.
Fast.
Jangan self-medicate. Yeah, that's one important thing. You can start the basic things lah, but always get opinion from doctors, discuss first, and then lepas tu you can proceed. Okay. Then second thing, beauty salons. What I notice is that sometimes they tend to cause a little bit more scarring. Yeah, if they're just doing basic facials, then it should be okay. But sometimes they do a lot of extraction. They do a lot of comedomal extraction. The nodules tu diorang pecahkan. I believe their aim is to clean up and to make it a little bit flatter. Yeah, but they don't know that when they do it the wrong way, they actually cause a lot of depressed scar in this.
Scarring.
Yeah, so careful with that. I have a lot of patients who go in for facial, so I tell them that extraction part of it, be a little bit more careful. And then early treatment, aggressive treatment for nodulocystic acne is very very important. And then the last one, kalau those of you yang ada black marks, pimples kecil tapi jadi hitam, so sun protection is very very important. Okay, so that's all.
Yeah.
Thank you.
Wow, that's wonderful summary from Dr. Usha. Dia dah menzahirkan hope beliau. Dia mengharapkan tak adalah daripada kita, daripada teenage, anak-anak remaja sehingga dia wanita-wanita even usia 40 menghampiri 40 tidak develop scars. That's our aim, that's our goal, yeah, that's our challenge of course. And of course we must become with the co-manage, you know, sama-sama kita doctors and patients must be clear what our goals and direction. With that, Dr. Usha, I thank you a lot for your time and especially on Sunday, Dr. Usha, sebenarnya ya nak rehat-rehat. Dr. Usha berehat hari ni hari Ahad, ya. So sekali lagi hari Ahad ni kita dah kacau and thank you again. Dr. Priscilla from Priscilla. Yeah, from Priscilla also, she's here with us. Wonderful explanation, informative. Thank you, Pris. Thank you for supporting us. With that, Dr. Usha, sebelum itu kita nak share sikit sebelum we say goodbye to all the viewers. Minggu hadapan, tarikh dan date Ahad, masa yang sama 11 pagi juga kita ada satu lagi profesor dalam psikologi yang jemputan khas iaitu dinamakan Prof. Rahmatullah. Beliau akan mengupas ataupun berkongsi topik yang menarik juga saya boleh katakan, iaitu di kala kita semua ini menghadapi pandemik, topik kita akan bawakan strategi to manage kesan pandemik terhadap emosi wanita yang berkerjaya. Usha, you and me, kita masih berkerjaya, we are still go to work. Thank God with the current pandemic, kita tak tutup klinik kan, kita masih lagi serve the nations, kita masih lagi menjalankan tanggungjawab kita sebagai doktor to serve for the country, and still kita nak tahu apakah sekiranya ada kesan-kesan emosi terhadap pandemik yang berlaku dalam kepada kita, kepada especially women. Alright, so stay with us everyone. Kalau lock your date so that kita boleh berjumpa lagi minggu hadapan. Just itu, thank you again Usha. Have a good day, have a nice weekend please. And everyone please stay safe. Dr. Usha juga. Dengan itu Dr. Linda dengan ini mengucapkan terima kasih sekali lagi dan saya sudahi dengan wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Bye everyone.
Bye.